The ICU bed pressure at UMMC has dropped off, a sign that the COVID-19 demand for medical care is changing. But the state medical care facility says it is still feeling the financial brunt of COVID-19. In the spring of 2020, the hospital laid off more than 200 healthcare workers, instituted pay cuts, and projected losses of millions of dollars.
So where we are now, from the standpoint of when the pandemic began to now, we have had about $110 million loss in clinical revenue.
Some of that loss has been offset by federal funding from the CARES Act, an estimated $75 million received by the state hospital system. But the revenue losses continue as the hospital has had a dramatic reduction in elective procedures and a growing number of patients who no longer have insurance because they lost their job. Woodward says treating a COVID-19 patient is not a windfall for hospitals.
We take up beds for a lot longer. The reimbursement is much lower than it is for elective surgical procedures and where you've got a fair amount of turnover.
The financial plan for the hospital has also turned into a recruiting battleground. Hospitals in other states like Texas have offered more than twice what UMMC has offered for critical care nurses. By the hospital's own admission, registered nurses make about $30 an hour. In some cases, UMMC has offered critical care personnel $75 an hour.
On one hand, it's a full court press to compete and to hire these nurses that are in such short demand. But on the other hand, there are other positions that we cut and that we're letting go. Internally, that's tough messaging.
And Woodward says the tough messaging is going forward as the hospital system navigates through this uncertain future in healthcare and the pandemic, and the likelihood that more jobs will not be filled.
We're not planning to make those positions up. And like I said, in fact, the plan is by the time we get to the end of June, that number is around 300 or a little more. And we're achieving that by not hiring back every position that becomes open.
UMMC operators predict they are still somewhere in the range of $40 million in the financial hole because of the lingering impacts of the pandemic. They are hoping through reductions and other job cuts, they can at least break even by the month of June, the end of the fiscal year. But they admit there is still so much uncertainty about what remains to be an ever-changing pandemic. At UMMC, Scott Simmons, 16 WAPT News.